Thank you, Mr. Chairman, and thank you to our witnesses for being here today. Today's hearing is about something very real for the people I represent, whether they can reliably and affordably access the medicines they depend on, and whether we, as a nation, are building that capacity here at home or outsourcing it abroad. In Ohio's 11th district, we have some of the best healthcare systems and research institutions in the country, from the Cleveland Clinic and Metro Health to university hospitals and Case Western Reserve, alongside a workforce with a long history in advanced manufacturing. So when we talk about pharmaceutical supply chains, we're not just talking about global competition, we're talking about whether communities, like the ones I represent, are positioned to produce, innovate, and deliver the medicines we all rely on. Right now, we know that too much of the upstream supply chain, key ingredients and materials that go into essential drugs, is concentrated in China. And at the same time, China is moving aggressively into drug development and clinical research. Those developments create both short-term vulnerabilities in access to components and long-term risk to American leadership in innovation and production. For Northeast Ohio, this is also about economic opportunity. We have the institutions, the talent, and the infrastructure to be part of the solution, but only if federal policy is aligned to support domestic manufacturing, strengthen our research ecosystem, and build resilient supply chains with trusted partners. Because at the end of the day, this is about more than competition. It's about health security, economic security, and making sure American communities are not lost or left behind. So Dr. Wolszynska, you've highlighted that our greatest vulnerabilities are often upstream, such as the level of key starting materials or active ingredients. What are the top targeted actions we should take right now to reduce our dependence on China for essential medicines that patients rely on every day?
Thank you so much for this question. For essential medicines, the ones that were likely to compete with China in a conflict, and frankly with any other country, I really do think that full onshoring of those medicines, including figuring out ways to make the key starting materials here, either chemically or using synthetic biology, is the way to do this. This is, again, not going to happen on its own. There needs to be funding for this. And if you think about, we're thinking about national security, and, it's good to put it in the context of how much DOD spends on, let's say, a fighter jet. Mm-hmm. It might be close to $100 million per fighter jet. The Office of Industrial Base in Asper, since I think the last 6 years, their budget was $188 million. They're supposed to be the ones helping to build that infrastructure in the US. So we're talking about 2-3 jets over 6 years. So, again, this is a big call to Congress. Chair Molinar, this is a way for Congress to step in, and, the money needs to come with that. But those medicines are actually a very small slice of what we take. If you were to take the Asper 86 top essential medicines, I would be surprised if they ever made up 1% of the patients that touched 1% of the patients that are in the US. We really need to be thinking strategically about what we're going to do about everything else. Statins, SSRIs, blood pressure medications. This is where working with allies, I think, is really critical. In an ideal world, we would onshore everything, but again, where's the money coming from? So we need to think about how can we work with India to have them de-risk themselves so that we can continue to have those medicines, which is, if you think about your constituents, they're probably more likely to be on a statin than end up in an emergency room and need a critical medicine. So we need to be thinking about both.
Thank you. And Mr. Cashman, from your perspective as a domestic manufacturer, we know the U.S. has the capacity to produce more here, but we're not scaling at the level we need. In a region like mine, Northeast Ohio, one that has strong manufacturing base, skilled workforce, and proximity to major healthcare systems, what is the biggest barrier to bringing that production online?
Probably the biggest barrier is getting the right equipment and people trained and prepared to scale up manufacturing quickly. Obviously, once you have demand, we can scale up very quickly at our facility. We have plenty of production space. We have a lot of equipment. Some of that equipment needs to be updated and upgraded so we can produce more efficiently. And then we need to find good qualified people and train them to manufacture the medications.
Thank you so much. And if, Mr. Chairman, you'll allow me to close. Ultimately, this should be about making sure Americans can count on safe, affordable medicines that bring communities like Northeast Ohio be a part of that building of the future. If we get this right, we can strengthen our supply chains, support American jobs, and maintain our leadership and innovation. And with that, I look forward to continuing to work with my colleagues on solutions that deliver for both our constituents and our country. I yield back.